Beyond the well-known blood groups of A, B, and O that include A, B, and O, there is a crucial factor called the Rhesus factor, indicating the presence or absence of protein on red blood cells. This leads us to classifications of negative and positive blood groups, such as A negative, B negative, O negative, as well as A positive, B positive, AB positive, among others.
The Rhesus factor basically just means a protein or a marker that is on top of your red blood cells, and if you have it, we say you are Rhesus positive. If you don't have it, you're called, you say you're Rhesus negative. So on your record, when we do the blood grouping, you may find your blood group A positive. It means you have blood group A, and you also have the Rhesus factor on your red blood cell.
However, while the Rhesus factor typically possesses no issue for individuals, it is crucial during pregnancy, especially for women who are Rhesus negative. This becomes a concern when the father is Rhesus positive.
If you don't have the Rhesus factor and you're Rhesus negative, and you become pregnant and carry a baby, and your baby inherits the Rhesus factor from the father, so the baby is Rhesus positive, and for you, you're Rhesus negative. It means there is a very high chance that the baby will get complications related to that.
Dr. Fred Bwanga, a lecturer at Makerere University and laboratory director at MBN Laboratory, says that during the first pregnancy, there is a minimal risk of the mother's immune system attacking the baby.
This firstborn might be produced well and healthy baby, but during the subsequent pregnancies.
However, subsequent pregnancies become risky. Experts say the mother's body develops an immunity against that of the baby during childbirth or miscarriage, since two blood types are likely to mix.
Or during ectopic pregnancies and things like that, or accidents where the two blood groups may mix. The woman's body will develop an immunity against the Rhesus positive. It is negative. So it will read the baby's blood group as a disease or a disorder. So the next time she becomes pregnant, it means that likely that immune system will destroy the baby and cause problems, whether ranging from miscarriages to babies getting what we call hemolytic disease of the newborn, where the baby loses most of their blood inside the uterus, sometimes deaths, what we call stillbirths, and sometimes other problems like jaundice after birth.
Once one discovers that the mother is Rhesus negative during antenatal visits, health workers usually demand that the man's or partner's blood group be tested. Dr. Musana says the mother is given a drug called anti-D to prevent complications. This drug is administered at every pregnancy, though it's costly.
I think it's about between 160 to 250,000 shillings. It is given when the mother in that pregnancy has made at least 7 months of pregnancy. We don't give it before because it may not be as useful. So 28 weeks or 7 months, we then give you the anti-D to protect this current baby. And when you give birth, so when you're pregnant, 7 months we give you. When you give birth, within 3 days of giving birth, we must give you another dose of the anti-D.
Experts recommend taking this shot during the first pregnancy, despite minimal risk, as a precautionary measure.
If the mother was given this medicine at the first pregnancy, and then the mother becomes pregnant for the second baby, is it important to give the medicine? The answer is yes. So because we are giving that medicine, or the caring doctor is giving that medicine to the mother at every pregnancy event, to block the mother's immune system from getting sensitized. Okay, so at every subsequent pregnancy, the mother should get what? That drug.
Despite the challenges, health workers reassure mothers that it is safe for couples with different Rhesus factors to marry.
If the man is positive and the lady is negative, they can marry, it's okay, but then they should be near their doctor during the first pregnancy, to administer the other drug at the right gestation age of the pregnancy and the 3 days after birth. And then also in the subsequent pregnancies, the same thing.
Experts have urged the Ministry of Health to raise awareness about Rhesus compatibility and urged women to know their blood group types early to avoid such complications. Statistics show that 15% of 100 women world population is Rhesus negative. Nobat Atkunda, NTV News.